we are looking at treatment for shock. We want to know how shock can be treated or how shock can be managed. Shock management follows the general rules priority action approach. Step number 1, ensure no danger. Then check circulation and stop bleeding. Then the next step, ensure open airway. Check breathing whether is adequate. Basically, I've given you 4 things. These steps, you perform it when you are performing the primary survey, whereby when there is no ABC, that's airway, breathing, and circulation, that's where you begin to check or to perform what we call CPR, cardiopulmonary resuscitation. Remember, when we're explaining cardiogenic shock, we said cardio pertaining the heart. Right. Next step, when you are treating shock, administer oxygen if required. Then conduct a systematic and gentle examination for further injuries. Now, whereby you check from head to toe. That's under secondary survey. Check for any bleeding, for any injuries, beginning from the head to toe. Next step, prevent the loss of heat by placing blankets under and over the casualty. Position the casualty to protect the airway if he or she is unconscious. In this scenario, there are certain positions you should use when positioning a casualty. For example, you position the casualty in a recovery position. Then the next step, splint fractures. Splint will lessen bleeding from the injured part and minimize pain, discomfort that can be further aggravated by shock is also minimized. Right, splint. A hot metal can be used as a splint, or alcohol. Alcohol is a hot stuff, can be used as a splint. It will prevent infection of the injured part and also lessen bleeding. Then the last general rule, priority action approach that you are supposed to follow, avoid rough and excessive handling of the casualty. Place the casualty in a position of most comfort, thus keep the injured casualty in supine unless the casualty has heart attack or lung disease. Then semi-sitting or sitting would be most comfortable. These are the general rules priority action approach that a healthy practitioner can exercise or can manage to do when treating shock. For today, viewers, our part 2 ends here. Have a good day.